You know what's scary? What is so scary is a lot of people think heart attacks happen suddenly. Like one random day out of nowhere, boom, chest pain, emergency room, heart attack. But honestly, for many people, their body has been warning them for years. The problem is, these warning signs became so normal that people stop seeing them as warning signs. Being tired all the time, snoring badly, needing naps, knee hurting, running out of breath walking upstairs, blood pressure creeping higher every year, feeling fatigued, feeling heavy, brain fog, needing more caffeine just to function. And eventually people start saying things like this. Well, I'm just getting older. But sometimes it's not aging. Sometimes the body is quietly losing its metabolic health. And today, I want to walk you through a patient case that honestly represents millions of people. Now, obviously, this is educational, not medical advice for your personal situation. But this is how I think as a preventive cardiologist and obesity medicine physician. When somebody walks into my office like this, 42-year-old male, BMI of 36, high blood pressure, high cholesterol, sleep apnea, knee pain, fatigue, and a CT scan that already showing plaque starting to build in the coronary arteries. And when he sat down in front of me, he looked frustrated. Not lazy, not careless, frustrated, and honestly, a little bit defeated. And he told me something that stuck with me forever. He said, "Doc, I feel like my body is slowly shutting down." And unfortunately, a lot of patients feel that way. So today, I'm going to show you exactly how I approach this kind of patient step by step. Not social media fantasy, not fake internet hacks, real medicine, real obesity treatment, real preventive cardiology. And this is only episode 1 because over the next few videos, we are going to follow this patient's journey through lifestyle changes, GLP-1 medications, plateaus, side effects, cholesterol improvement, blood pressure changes, and long-term maintenance. And trust me, some parts of this journey are harder than people think. So let's start from the beginning. Treating obesity is not just about weight. It's more than that. And one of the biggest mistakes people make is thinking obesity is only about appearance. That's one of the reasons obesity medicine gets misunderstood online. People think, well, just eat less or just go to the gym. But obesity is much more complicated than that. Because when somebody develops obesity, especially visceral obesity, which is the fat in the center part of the body, it affects almost every organ system in the body. Blood pressure rises, insulin resistance develops, inflammation increases, sleep apnea worsens, hormones change, joint stress increases, fatty liver develops, and triglycerides go up. And over time, the cardiovascular system starts paying the price. Well, now let's talk about this patient. He works at a stressful job, sits most of the time, minimal exercise, eats fast food multiple times a week, sleeps poorly, feels exhausted constantly, emotionally stress eating at night. And honestly, very common. This is very common picture. This is not just unusual patient. This is everyday America now. And something important I want people to understand. Most patients already know they need to lose weight. So you don't need to shame them. Most of them already tried multiple diets, keto diet, fasting, calorie counting, meal plans, supplements, detox, fat burners. Some lose weight temporarily and then gain it back. And every time that happens, they lose confidence in themselves a little more. That psychological component matters because obesity is not only biological, it is emotional too. And one thing I immediately noticed about this patient is exhaustion. This patient was exhausted, not just physically, mentally exhausted. And many patients feel trapped because they are dealing with cravings, stress, work, family, poor sleep, emotional eating, and low energy. While society keeps yelling, just have discipline. Now, discipline matters, don't get me wrong. Absolutely matters, but biology matters too. And if we ignore biology, my friends, we fail patients. Now, there is a cardiovascular risk behind obesity. And this is when things become serious. The patient had CT coronary showing plaque formation. And this is where many people get shocked because he never had a heart attack, never had a stent, never had open heart surgery. He's only 42-year-old. So in his mind, he thought, I'm still young. But coronary artery disease starts early, very early sometimes. And plaque doesn't appear overnight. It builds silently over years. That's why preventive cardiology matters so much. Because ideally, I would like to meet these patients before catastrophe happens, not after the heart attack. So let me explain plaque simply. Well, your arteries are like flexible pipes. Over time, high blood pressure, high LDL cholesterol, inflammation, smoking, diabetes, obesity, sleep apnea, all of these things damage the artery lining. Then cholesterol particles start entering the artery wall. Inflammation develops and plaque slowly forms. Now, some plaques are stable, while others become dangerous. And eventually, one unstable plaque can rupture, and a clot will form, and suddenly a heart attack. So when this patient came in, I wasn't thinking weight problem. I was thinking cardiovascular risk problem. And that changes the whole conversation. And this is something I wish more people understood. Obesity medicine is preventive cardiology. Very often, they are deeply connected. Another thing that I would like to reflect is sleep apnea. This is a huge issue with this patient, obstructive sleep apnea. And honestly, sleep apnea is massively underdiagnosed. People joke about snoring, but severe sleep apnea can seriously damage health. And this patient told me that he has loud snoring, daytime fatigue, morning headaches, feeling sleepy during the day, poor concentration, classic symptoms. Now, what happens in sleep apnea? During sleep, airway repeatedly collapses. Oxygen levels drops. The brain panics. Stress hormones surge. Blood pressure rises, and sleep quality becomes terrible. Over and over and over again all night, sometimes hundreds of times. What's scary here is many patients don't even realize how exhausted they truly are until treatment starts helping them. Now, why does this matters in cardiology? Because sleep apnea is associated with hypertension, atrial fibrillation, stroke, insulin resistance, obesity, pulmonary hypertension, cardiovascular disease. And unfortunately, many patients ignore it for years. They think I'm just tired. No, you're not tired, my friend. Sometimes your body is just getting stressed every night when you sleep. And this patient, his sleep apnea was so severe enough that I knew if we ignore this, everything else becomes harder. Weight loss becomes harder, blood pressure control becomes harder, energy becomes harder. So sleep becomes part of the treatment plan, not an optional part of the plan. What about knee pain? So this patient reported that he has significant knee pain, and it hurt him badly, especially when he climbing up the stairs. And this creates a vicious cycle because people online love saying just exercise. But if somebody has obesity, joint pain, poor sleep, and fatigue, sometimes exercise feels miserable at first. Now, obviously, movement matters, don't get me wrong, but we have to meet patients where they are. And this is where many patients fail because they try to go from sedentary, sitting on the couch all day, to hardcore fitness motivation overnight. That usually crashes. Instead, I prefer sustainable progression. What about just start walking and then small increases? Build consistency first, not perfection. And honestly, this is where I start talking to patients about realistic expectations. Because my friends, social media has destroyed expectations. People think 2 weeks and I will transform. Nothing like that. That's not true whatsoever. Real metabolic healing takes time. But when it works, it can completely change somebody's quality of life. Okay, so now before I throw medications at somebody, I want to understand the whole metabolic picture. So what do I typically evaluate? Well, blood pressure patterns, weight trends, waist circumference, sleep quality, dietary habits, stress levels, exercise tolerance, emotional eating, and lastly, family history. We also do lab work. Things like lipid panel, A1C, liver enzymes, kidney function, thyroid function tests, insulin resistance markers sometimes. Because obesity is not always just calories. Sometimes there are multiple drivers happening together. Now, another important thing, I also try to understand why the patient eats. That sounds strange to some people, but emotional eating is real. Stress eating is real. Binge eating is real. Night eating is real. And many patients use food almost like emotional relief, especially after stressful days. And unless we recognize that, long-term success becomes harder. Now, during this visit, the patient admitted something important. He said, "Doc, I feel out of control around food sometimes." That honestly matters and very important because now we can actually address the problem realistically, not just pretend it is all about willpower. Okay, so here's comes the hardest and difficult part because patients often want rapid results, quick fixes, and one medication to solve everything. But I had to explain something honestly. This process requires long-term change, long-term commitment, not temporary punishment. And I told him something I say often. We are not trying to create a miserable life you can't maintain. Because if a diet feels horrible, most people quit. So we discuss protein intake, reducing ultra-processed foods, sugary drinks, sleep, walking, hydration, structured meals, reducing mindless nighttime eating. Not perfection, progress. And honestly, one of the biggest early goals is simply helping patients believe improvement is possible again. Because many patients feel hopeless by the time they reach obesity medicine clinics. And hopelessness, people struggle to stay consistent. Now, we will come to the medication discussion eventually. Medications are very important. This is where things get controversial online, especially GLP-1 medications. Some people think they are miracles. Others think they are cheating. Reality is more complicated. And in the next episode, I'm going to walk you through exactly how I decide whether a patient is a candidate for medications like Wegovy, Zepbound, the two popular like semaglutide or tirzepatide, including side effects, nausea, constipation, insurance problems, dose escalation, expectations, realistic outcomes. Because trust me, the first few weeks are not always easy. And what happened next with this patient honestly surprised even him. So if you made it this far, I want you to understand something important. Obesity is not failure, and asking for help is not weakness. The body is complicated. Metabolism is complicated. And preventive cardiology is not only about treating heart attacks. It's about preventing the disaster before it happens. That's the goal. That's my goal. Not just adding years to life, but adding life back to those years. Thank you so much for listening, and I wish you a great day. Bye-bye.